One might reasonably have assumed that in the 21st century, the United States would not require a tutorial on the catastrophic consequences of vaccine refusal. The 20th century, after all, provided ample instruction: the iron lungs, the quarantine wards, the tiny coffins. Yet here we are in the closing days of 2025, watching a nation that declared measles eliminated a quarter century ago slouch toward the humiliating loss of that distinction, with the blessing, indeed the active encouragement, of the very man appointed to safeguard the public health. As of December 23rd, more than 2,000 confirmed measles cases have been reported across 44 states, with 50 outbreaks recorded, compared to 16 outbreaks in all of 2024. 3 people are dead, including 2 children in Texas, a 6-year-old and an 8-year-old, marking the first measles fatalities in the country since 2015. January 20th, now just weeks away, will mark 12 straight months of uninterrupted measles transmission, and health experts regard the loss of America's elimination status as virtually certain. The last time the nation saw numbers this grim was 1992, before most of today's parents were old enough to remember what measles could do. The proximate cause of this disaster is no mystery. Robert F. Kennedy Jr., a man who has devoted decades to the promulgation of medical falsehoods, now occupies the office of Health and Human Services Secretary. He was confirmed 52-48, with only 1 Republican dissenting. The Senate knew precisely what it was getting. Kennedy had spent years as chair of Children's Health Defense, an organization that engaged in relentless anti-vaccine propaganda and helped flood social media with disinformation linking vaccines to autism, a claim refuted by more than 40 high-quality studies involving over 5.6 million people across 7 countries. Kennedy's curriculum vitae includes a particularly damning episode that his Senate interlocutors largely chose to ignore. In June of 2019, he traveled to Samoa, where vaccination rates had already plummeted following a tragic incident in which 2 infants died after nurses mistakenly prepared vaccine doses with an expired muscle relaxant. Into this crisis of public confidence stepped Kennedy, seeking to exploit a deadly vaccine accident and meeting with local anti-vaccine activists. Vaccination rates for eligible 1-year-olds fell to 31-34%. 5 months later, Samoa endured a measles outbreak that infected more than 5,700 people and killed 83, most of them children under 4. Kennedy has consistently denied responsibility. He has questioned whether measles actually caused the deaths, calling it a very controversial supposition. This is akin to questioning whether drowning causes death in people found at the bottom of swimming pools. Dr. Paul Offit, director of the Vaccine Education Center at Children's Hospital of Philadelphia, has been unequivocal. Kennedy had everything to do with that, and disinformation can kill. Now installed in Washington, Kennedy has performed precisely as his record promised. At Donald Trump's first cabinet meeting following the inauguration, Kennedy described the Texas outbreak as not unusual, a claim that infectious disease experts immediately rebutted. He incorrectly stated the number of deaths and mischaracterized the reasons for hospitalization. In a Fox News interview, he made numerous false claims, including that it is almost impossible for healthy individuals to die from infectious disease, and that the child who died may have been malnourished, despite health officials' statements that she had no underlying conditions. The contrast with the previous measles crisis could not be starker. In 2019, when outbreaks cropped up across the country, Trump himself told parents, "They have to get the shots. The vaccinations are so important." CDC Director Robert Redfield stated then that the way to end this outbreak is to ensure that all children and adults who can get vaccinated do get vaccinated. No one died in those outbreaks. Today, with children in the ground, the government's messaging has become a study in equivocation and misdirection. A study published in the journal Vaccine found that the CDC posted just 10 times about measles on social media during the first 7 months of 2025, compared to an average of nearly 46 posts during the same period in each of the previous 4 years. The agency's voice has been silenced precisely when it was most needed. CDC experts felt restrained from talking openly with local public health workers, according to interviews with 7 CDC officials. A public health director in Lubbock, Texas wrote in an email, "CDC hasn't reached out to us locally. My staff feels like we are out here all alone." A child would die before CDC scientists contacted her. The administration's capacity for self-sabotage appears boundless. In late March, the CDC abruptly canceled $11.4 billion in funding for state and local health departments. In Dallas County alone, this forced the cancellation of more than 50 vaccination clinics, Many planned for schools in areas with low vaccination rates, where shots would have been offered free to families. 21 workers were laid off, including epidemiologists and lab staff involved with measles surveillance. HHS justified the cuts by declaring that the COVID-19 pandemic is over and that the department would no longer waste billions of taxpayer dollars responding to a non-existent pandemic. That those funds were also being used to combat measles apparently escaped their notice or their concern. On April 6th, Kennedy attended the funeral of an 8-year-old girl who died of measles in Lubbock. Hours later, he praised two controversial doctors, one of whom had released a podcast describing mass infection as God's version of measles immunization, and the other of whom had been disciplined by Texas medical regulators. Meanwhile, Covenant Children's Hospital in Lubbock reported patients with signs of vitamin A toxicity after their parents followed Kennedy's promotion of the nutrient as treatment. Kennedy had claimed that the toxicity issue is no longer an issue. The children's blood work suggested otherwise. The culmination of this campaign arrived in November when Kennedy ordered the CDC to alter its website on vaccines and autism. A page that once stated unequivocally that vaccines do not cause autism was rewritten to declare that this claim is not an evidence-based claim because studies have not ruled out the possibility that infant vaccines cause autism. This is, as Dr. Offit noted, an exploitation of a technicality in the scientific method, the same logic by which one could claim that chicken nuggets might cause autism, since no study has specifically disproven it. Senator Bill Cassidy, who had voted for Kennedy's confirmation after receiving assurances that such language would not be removed, issued a statement condemning the change as wrong, irresponsible, and actively makes Americans sicker. Dr. Deborah Howry, the CDC's former chief medical officer, said the agency's scientists had nothing to do with the website change. Scientists were not involved in any of these decisions, and when you remove science from scientific information, you get ideology. Dr. Offit offered the epitaph, "The CDC is being weaponized to promote RFK Jr.'s anti-vaccine point of view, so why should you trust it?" There is a particular obscenity in watching Kennedy invoke parental choice, while children die from a disease that vanished from American life within living memory. You research the baby stroller, you research the foods that they're getting, and you need to research the medicines that they're taking as well, he told an audience, as if the accumulated knowledge of immunology were equivalent to Consumer Reports ratings for infant car seats. This is the language of abdication dressed in the vocabulary of empowerment. It is not a coincidence, observed Fiona Havers, adjunct associate professor at Emory's School of Medicine, that the first year where we've had 12 months of continuously circulating measles is the first 12 months of this administration. Michael Osterholm, director of the Center for Infectious Disease Research and Policy at the University of Minnesota, offered a grimmer assessment. This administration is only pouring more gas on the fire with the kind of comments that are coming out of HHS. The mathematics of measles are unforgiving. One infected person can transmit the virus to 12 to 18 others in an unvaccinated population. 1 to 3 children per 1,000 who contract measles will die. 1 in 20 will develop pneumonia. Only 4% of this year's more than 1,800 cases occurred in people who had received 2 doses of the vaccine. The MMR vaccine is safe, effective, and has been protecting children since 1963. These are facts impervious to the ministrations of conspiracy theorists, even those with cabinet portfolios. It's horrifying and it's embarrassing that our country, the technological leader of the world, will lose our designation of measles being eliminated when this is completely preventable, said Admiral Brett Giroir, who served as HHS Assistant Secretary under Trump's first administration. It's actually shameful. Shame, however, requires the capacity for self-reflection. Kennedy has demonstrated none. The graves of children in Texas testify to the cost of his convictions. By the time the bureaucratic machinery confirms what epidemiologists already know, that America has lost its measles elimination status, the accounting of preventable deaths will have grown longer still. The virus does not negotiate. It does not respect ideological commitment or political alignment. It simply spreads, feeding on the gaps in immunity that ignorance and policy have jointly created. 25 years of public health achievement erased in 12 months. The arc of the moral universe, it turns out, does not always bend toward justice. Sometimes it bends toward measles.